Hello, everybody. Welcome back to Fertility Fact or Fiction. Another week of our great show. So we'll wait for everybody to log on. You know what? I'm going to move in and I'll maybe just move this guy back a little bit. How's that? I'm trying to get the video to be, so I can kind of look right in between and it'll look like I'm doing it. Hey, guys. How's everybody doing? Welcome back to Fertility Fact or Fiction. We're just getting everything set up and we'll be ready to go. Hopefully you all had a decent dinner. Just waiting for everybody to log on. We got an interesting topic tonight, and of course the ever-present, I will answer everything you ever wanted to know about coronavirus that I can. Give everybody a few minutes to log on and we'll go from there. No one's on Facebook. Oh, we got one on Facebook. We got a thumbs up. I love how they kind of peter out as they go up. That's pretty good.
Yeah, Facebook gave you some love.
I know, I saw some Facebook love. Okay, guys, on Instagram, have we got sound? Everybody let us know if we've got sound. I need a thumbs up if we have sound on Instagram. I think we've figured that one out. It should be there. Hi on Facebook. Welcome back. Good evening, everybody. I need my thumbs. Where are my thumbs? Yes, excellent. All right, good. Okay, so I'll just give everybody a couple more minutes. We'll get everybody logging on and then we'll go from there. I will prattle on in the meantime. So hopefully you are all taking every precaution necessary. Right now, essentially, the orders are shelter in unless you must be out. And as you all know, in Ontario, we are being asked to totally shelter in except for essential services only in 36 hours. We're going to find out more about what that means tomorrow. They were completely unclear as to what an essential service is, but I think we'll find out soon enough and be able to give you guys some good advice. And so hopefully we'll know what's going on very shortly and be able to further inform everybody out there on how to manage this. While you're at home, as much as possible, you want to wash your hands frequently, definitely when you're coming in the house and when you're leaving. Make sure if you touch anything from outside, you are being super careful, again, about rinsing your hands. Don't leave anything out and make sure as few hands touch things as possible. On cardboard, they did detect that this stuff can live for up to 3 days, on metal surfaces for about 24 hours, and in the air for, they think, about 3, although it wasn't the most reasonable way to test it. So make sure that you are employing every single precaution necessary. Do not take any chances. The hand sanitizing is real. If you're going out, a mask certainly can't hurt. It's probably of limited help unless it's the N95 mask, and those have to seal around your face, and you actually need testing to make sure it's a good seal. So it's not just, hey, go to Home Depot and slap on an N95 mask. But we'll see how it goes. Can you grab that for me and see who that is?
Hello?
Okay, so we're just getting a phone call from the hospital. Let me just see what's going on, guys. Give us 1 sec. Do they need me?
I don't know.
Well, I may need to take a pause in a minute, guys, but in the meantime, we're going to start chatting about letrozole.
Yes, hello.
So recently I had contact with a patient, and hang on 1 second. Do they need me? Oh, all right. Give me 1 second, guys. I got to take a phone call. Sorry. It's the hospital. Hello? Yeah. This is Dr. Victory. How can I help you? Uh-huh. some salt baths and just antibiotics. There's nothing else you can do. Yeah, and give a Caplexin flagyl. There's nothing else you can do. Yeah. Okay, thanks. Thanks. Bye-bye. Sorry about that, guys. My apologies. The hospital called from Emerge. So, bottom line is that I had a patient that I had contact with who told me something I had not really had experience with before, which was that the center she had gone to had used letrozole for assessment of, for preparation of the endometrium to get her ready for an embryo transfer. And this was a patient who'd had some considerable difficulty before. And in her particular circumstances, I actually wasn't quite convinced it made sense, but I decided to look it up because this was not something I was accustomed to doing, and also wasn't something I had much experience, hearing about or seeing anywhere else. So I looked up using letrozole for frozen embryo transfers, and this is exclusively for having patients who have done in vitro fertilization. They've created a frozen embryo, whether it was a freeze-all cycle or whether it was because they were doing pre-implantation genetic testing. And so they now want to go to get the lining of the uterus ready, which we always have to do in order to kind of put the embryo in and land it. So that lining of the uterus has to be prepared for that occasion, and you prepare it by giving the patient estrogen and then subsequently progesterone and transferring it in. And that's typically a hormonal cycle or an artificially created or stimulated cycle. So there are many different ways to do this, but some patients have had the experience, or some centers are using the protocol of actually giving the patients letrozole. So what's letrozole? Letrozole is a drug that we typically use first and foremost in young breast cancer patients. This is what's called an aromatase inhibitor, and it overall reduces your body's estrogen levels. If you give it to women with polycystic ovarian syndrome for just 5 days, in about 95 to 97% of cases, at the right dose, it will make them ovulate. And then if you use it for about 6 months in those PCOS patients, it gives you a 27.5% live birth rate. So with the IVF cycles, the theory was maybe if we give letrozole to patients who are undergoing a frozen embryo transfer, it can get the lining ready a little more naturally, and maybe this is going to alter the success rates. So there are 3 or 4 sort of main studies I looked at. Several of them are older, so I tried to focus on the newer ones. And they're really very, very interesting studies. So the first one that I think is really valuable is a study from Japan, published in Human Reproduction, and it's called Pregnancy and Neonatal Outcomes Following Letrozole Use in Frozen Thawed Single Embryo Transfer Cycles. So the title pretty much says it all. They gave these patients letrozole. They followed them until their lining was ready. Once the lining was ready, they gave them some progesterone. They went ahead and did the frozen embryo transfer, and then they determined what the outcomes were. The numbers from this study are enormous. So the total number of single embryo transfers was 110,722, and about 2,400 of them roughly were cycles with letrozole. 41,000 were purely natural, and 66,000, almost 67,000, were patients that had received a more traditional hormonally stimulated cycle where we're giving them estrogen and then progesterone, and we usually use something to prevent ovulation such as Lupron, or some people will use an antagonist drug. So there was a comparison between the letrozole group and the natural group, and between the letrozole group and the hormone replacement group. So there's some very, very interesting numbers that come out of this, and that's what I really want to share with you guys. So when you looked at the adjusted rates, so these are after they've controlled for confounding risk factors like age and number of embryos and number of eggs and things like that. If you looked at the blastocyst group, so these are the groups that had day 5 embryos, which are called blastocysts, for transfer, the clinical pregnancy rate was 57% higher when you compared letrozole to the natural group. So in other words, you had a 57% higher chance of pregnancy if you got letrozole compared to just your natural cycle. And in the letrozole versus the hormonal group, it was 71% higher, which is staggering. Now that's clinical pregnancy for seeing a heartbeat. When they looked at miscarriage rates, really interesting data here, the miscarriage rates with letrozole are lower. So you're actually seeing decreased miscarriage. About a 9% decrease when you compared it to natural, and about a 16% decrease when you compared it to the hormonally stimulated or manipulated cycle. Most importantly, we always talk about live birth. That's the holy grail of all things IVF. And again, the adjusted risk was 45% higher for patients that used letrozole compared to the natural group. And it was actually 56% higher compared to the stimulated group. So in this particular study, obviously huge numbers, it does look like it is very beneficial to use letrozole ahead of time to stimulate the preparation of the lining rather than using either a natural or a artificially stimulated cycle. So this is kind of big news because this is a big paradigm shift. These kinds of stats are not the kinds of stats we normally see in the IVF world. Small increments, 5% here, 10% there, we see fairly frequently, but you rarely see something where you're seeing 50, 60, 70% numbers, and you very, very rarely see anything where you're seeing a decline in miscarriage risks, and a 16% decline in miscarriage is huge. Now, problems with this study, this is a retrospective study. What that means is that they previously had all these patients go through, somebody sat down, probably sat at a computer, pulled all of the data from before, and then put people in the appropriate groups and analyzed it. Obviously, that introduces potential biases into the data stream. And so this kind of study is not ironclad, it's not 100%. Unfortunately, there are very, very few randomized controlled trials of letrozole for frozen embryo transfer, and the ones that are available are very small and not necessarily very well done. So we have to rely on this retrospective data. So the next study, which was pretty interesting, is letrozole use in women doing frozen embryo transfers, but specifically in women that had polycystic ovarian syndrome. So this group was quite interesting. They basically gave them the letrozole for 5 days like they normally would, but they followed women out till about day 10. They did an ultrasound. If they did not have an egg growing, they actually gave them a little bit of human menopausal gonadotropin. So this would be an FSH analog that was not recombinant. It was urinary derived. And that's an injectable medication that will help you grow your eggs. They made the eggs grow, and then once they made the eggs grow, they would trigger the release of the egg when it was around the 17 millimeter and the endometrial thickness was enough. They then started the patients on progesterone, and they then went ahead and did the embryo transfer 5 days later. So in this study, the main focus was a lot of data on miscarriage. And if you looked at the adjusted rates again after they corrected for confounding factors, there was a 50%, 49% to be exact, decrease in miscarriage. There was a 24% increase in ongoing pregnancy rate and a 33% increase in live birth. All of these being very highly statistically significant. So these are really, really significant data points to look at where we're actually seeing a huge increase in outcomes that are beneficial. Less miscarriage, higher clinical or ongoing pregnancy, higher live birth rates. So again, this study, not quite as large, a much smaller study. There were 2,664 patients. It's published in Fertility and Sterility from just last year, but nevertheless, very substantial data that is demonstrating that there is an improvement in the outcomes. The final study was from, again, Fertility and Sterility, and this one is from 2017, I want to say. Oh, sorry, 2019 as well. And again, much smaller. There were only 204 patients that did not get treatment. There were 143 that did get treatment and 176 in another group. So the three groups were no treatment getting a GnRH agonist, which was Lupron, which basically kind of puts you temporarily into menopause, or getting the GnRH agonist as well as letrozole for a period of 2 months. And this was daily letrozole, not just for 5 days, but actually for the full 2 months. And all of these patients were patients who had previously done frozen embryo transfers, but had failed and had recurrent implantation failures. So multiple attempts, and in this particular study, at least 2 previous trials of doing a frozen embryo transfer without a successful outcome. So in this study, they again compared the different groups. So no treatment, Lupron alone, or Lupron with letrozole. So in the no treatment group, the clinical pregnancy rate, so again, seeing a heartbeat, was 40%. In the GnRH agonist alone group, so this would be Lupron alone for 2 months, 42%. And in the group that got Lupron and letrozole, they had a 63% clinical pregnancy rate. Very, very highly statistically significant outcome. Again, when they looked at live birth rates, 34% in the no treatment group, 36% in the GnRH agonist group, and 56% in the group with the GnRH agonist and letrozole. Now, all of these studies propose theories for why the outcomes are better. A lot of it seems to revolve around the idea that if you reduce your estrogen levels, you increase estrogen receptors, which improves the quality of the lining, makes it respond better when they do start making estrogen. You get more blood flow and an improved sort of hormonal and structural milieu for the embryo to implant into. From the standpoint of recurrent implantation failure, there was another study, which I'm not going to go through because it's really hardcore scientific stuff, but they actually showed that the markers of implantation, and there are numerous markers, proteins that people have looked at that are important for your implantation, actually go up when you're using Lupron with letrozole or even letrozole alone. And so the theory is there is actually molecular level changes occurring in the endometrium, which are improving your chances of success. So this week, the fact or fiction was, does letrozole actually improve your chances of a frozen embryo transfer success? And the answer is fact. It does appear that letrozole improves your chances of success with your frozen embryo transfer. And we are actually going to be revising our protocols once the coronavirus lets us start treating you guys all again. And we will be including letrozole in probably all of our cycles because it looks like widespread the data is pretty convincing that this helps. And most definitely in those specialty groups of PCOS as well as the recurrent implantation failures, it actually may be very beneficial. So I want to say a big thanks to the patient that brought this to my attention. If you're watching, thank you. I'm a big believer in learning, and so this was a great learning experience for me to know that there is a protocol out there which actually may be beneficial and improve our chances. And this is very uncommon. I mean, there are very few centers employing this. So I think this is a really golden opportunity for us to further enhance your success rates compared to what we were already achieving, which was pretty amazing already. So fact or fiction, yes, we're going to be using letrozole. Thank you so much for watching that segment of the show. We're going to do our answers to questions now. And I know that many of you are super concerned about the coronavirus, so we'll definitely address those as well as all the fertility questions. I do want to dispense with one really important thing first, and that is that I absolutely sympathize with all of you who are going through this horrible, horrible time in our history. I get it. Believe me, as a business owner, as a dad, as a husband, as friend and family member, I get it from every regard. And my heart goes out to all of you. We are struggling. I know you're all struggling. And so we all need to kind of muddle through this, stay together in spirit, if not physically, and do the best we can through this time. We do want to say that aside from the one patient who is currently actively doing fertility treatment with us because she had already started, we are going to hold off on doing any other further treatments for anybody. And we are going to pause on testing now too as the province moves to essential services only. So we will be contacting you to reach out if you are scheduled to do monitoring of a natural cycle. We are going to hold off on that, guys. We have cleaned with more Cava wipes than I can imagine. I think my own personal cancer risks are going through the roof, as well as my staff from touching so many cleaning agents. But the reality is that the safest thing to do is to keep you guys away from any risks, and the best way to do that is to not expose you. So we are going to temporarily shut down the fertility part of things. We will still do consults. We can still advise you. But at present, the recommendations from every society, every regulatory body is A, do not try to get pregnant, and B, definitely don't do any fertility treatments right now. So we will be holding off on testing as well. So hopefully that answers that for anybody that wanted to know that stuff. Okay, so I'm actually going to pull the screen a little bit closer, so if it looks like I'm zooming in on you, I'm sorry. Okay, maybe mention the mask we're wearing now. Oh yeah, okay, so my nurse Diane wants me to mention masks. So we are definitely wearing masks in the office. These are not N95 masks, but we are going out of our way to try and protect you guys from exposure. So I wore a mask all day today while doing my obstetrical patients. We will still see obstetrical patients here because we have to. And so, yeah, we're going to, minimize hand-to-hand contact, hand-to-body contact. All of you who have seen me know that the minute you do come into contact with me, I'm grabbing the hand sanitizer and making sure that you wash, and that I do as well. You probably can't see it, but my hands are barbecued already from all the hand sanitizer. So the real winner in this virus battle is Aveeno, because I keep squeezing Aveeno onto my hands to put some moisturization back into my skin. So yeah, we are trying to protect you with every method we can. We clean the room between each patient. We're even cleaning the door handles with Cava wipes. The beds get cleaned, the stirrups get cleaned, the computers get cleaned. We're cleaning our hands. So we're doing everything we can. The instrumentation, everything is being polished off to keep you guys safe. Okay. My wife has a C-section scheduled with you in April. So with this COVID-19, what should we do for prevention before going to the hospital? That's a great question. Standard stuff. So hand washing, lots of immunological beneficial things like vitamins, vitamin D, echinacea, natural supplements, eat healthy, avoid social circumstances. Do not go out to parties. Do not invite your family over. You need to basically shelter in place. So that's the best thing you can do to try and improve the outcomes here. If you are going to try and make it to the hospital, currently the rule is one person is allowed as a guest. I don't know that there are any planned changes, but there certainly could be. And if there are, those changes may necessitate that you actually go the battle alone. I spoke with David Moucher, the head of Windsor Hospital, the CEO. He said that we are not planning to do that yet, but it is a possibility and we may need to move in that direction. Instagram, let's see what questions we have here. Sorry if the screen is shaking, guys. Okay, let's see what we got. So question number 1. We have someone that says, I love listening to your medical advice. I think because of you, I am now pregnant. So thank you very much. Keep up the good work. Thank you. And congratulations. That's awesome. Thanks for sharing. That's very kind of you to share that. And super, super happy to be part of that. Who did this study? Which one is it? So nervous. Okay, so if you're talking about the studies, I can show them to you if you're referring to the ones we talked about. So one is by Steiner, Steiner, first initial N, and that's called Effective GnRH Agonist and Letrozole Treatment in Women with Recurrent Implantation Failure. It's Fertility and Sterility, Volume 112, number 1. The other one is Letrozole use during frozen embryo transfer cycles in women with PCOS. It's by Zhang, Z-H-A-N-G, also Fertility and Sterility, Volume 112, number 2. And the third one is Human reproduction, pregnancy and neonatal outcomes following letrozole use in frozen thawed single embryo transfer cycles. It's from T, like Thomas, Tatsumi, Tatsumi, and that is Human Reproduction, Volume 32, number 6. So hopefully that answers the questions of which studies. Okay, how will letrozole help those with endometriosis? Okay, so letrozole, because it reduces endometriosis, and probably through these mechanisms that they've studied where it shows that it's upregulating the beneficial implantation factors, is going to potentially help patients with endo. Now, it is complicated because if you're taking letrozole for a brief period of time, the 5 days, it actually should, in theory, increase your estrogen levels. So I'm not sure that's a great plan. Patients with endo will benefit from that recurrent implantation protocol where you're taking the GnRH agonist, which really kind of drops your estrogen levels down, and then also take the letrozole continuously for 2 months or 3 months. There's another study, randomized controlled trial, looking at Lupron and letrozole versus Lupron alone, and it did show a significant benefit when you use the two, but that's continuous letrozole. So I think that using a combination of continuous letrozole for a couple of months with the GnRH agonist in endo patients is definitely the way to go. We've been doing that for quite a few of our patients, and the success rate really has been quite remarkable. So we're really happy with that. Is there any negative side effect when taking letrozole? Aside from the standard stuff, headache, nausea, mood changes, nothing major. And it's pretty rare that we get complaints about letrozole from our patients that are taking it. Definitely different if you're using a GnRH agonist. That's straight into menopause, so you'll definitely feel that, and there are side effects for sure. Okay. Sorry if this has been asked already. ESR still doing your ultrasounds. Paranoid being almost 25 weeks and having to leave the house. Hi, Mel. Yes, ESR and Clear and the hospital are all doing them, and we will actually be coming online to do them here at our center where I have control over cleaning fairly soon. So we actually probably will be doing our ultrasounds here, even for anatomy scans and bios and things like that. That way we can literally hose down the room with every thing that we need. I do need to remind everybody out there, do not come into the office if you are sick or have been in contact with someone that is sick. I have nothing but the utmost respect for you all, but we cannot afford to let anybody get exposed. So if you have a cough, a cold, a sniffle, a sore throat, a fever, or have been around anybody with any of those things, do not come in. We will not let you in. There are big signs on our doors, and we stop you as soon as you enter. We won't let you come in, guys. Don't try. It's just detrimental to too many people, and we can't risk that for everybody out there. Where would I find the study? Okay, more about these studies. So can we post these somehow?
Yeah.
You know what? Tarek is going to post these for you. The one that I mentioned, I can put it there. Oh, in the resource center. Yes, I love it. Can we? But we can't. Can we just put the reference?
Yeah, we'll do something.
Okay, we'll put the link to the studies for you on our website in the resource tab, the resource center tab.
Video. We can put the links in the description.
And we can put it in the description of the YouTube video. So I'll make sure that Tarek will get that out to you guys, and you can pull them up from there. But I already read out that stuff that you needed. Okay, so somebody is asking in addition, if I do a dose of Lupron and letrozole and then do a FET, which is unsuccessful, can I do another FET the next cycle? Yeah, you can. It may be beneficial to continue on the Lupron and the letrozole, but you can definitely do it. No problem at all. I'm on 2 pills of letrozole for ovulating. This week is ovulation for me. Hopefully it works. Good luck. I hope it does. Be careful. The recommendation right now is that nobody try to get pregnant. No one, even if you're trying naturally or at home without insemination or IVF, because we don't know the effects of the virus, everybody's being told to hold off for now. There is no data, and let me say this very clearly, there is no data that the virus affects pregnancies, that it causes any mutations in the baby or has any adverse outcome whatsoever, no increase in miscarriages, anything like that. But the point is, there is no data. It doesn't mean there's evidence showing there's no effect. It means there's no evidence. So we genuinely don't know. So far, it looks pretty reassuring, but there is no evidence yet, so we can't reassure people, and that's why Canadian Fertility and Andrology Society, American Society of Reproductive Medicine, European Society of Hormones and Reproductive Endocrinology have all said don't try right now, hold off until further notice. Okay, I have my first OB appointment with you at the beginning of April. I will be about 14 and a half weeks. Will my visit still be at the office or a phone visit? I am high risk and only seen my family doctor once in around 5 to 6 weeks. Okay, so you should probably see us sooner if you're high risk, and that's going to miss our opportunity to do the EFTS, early first trimester screening for you, or enhanced first trimester screening for you. So why don't you give the office a buzz and tell them that I need to see you a bit sooner. We will be seeing obstetrical patients in person. We space everybody out about 15 minutes apart. 10 to 15 minutes apart, and like I said, we're really cleaning the rooms and all the equipment, and I feel like by now I'm practically showering in Purell, so don't hesitate to come in. You're safe from that regard. Okay. Is it normal for babies in utero to get the hiccups? We hope your daughter is out of isolation. Okay, so my daughter is not out of isolation. She is in a self-imposed forced isolation, God bless her, for another, I think, 7 days. And Jenny, I love you if you're watching. And thank you for being so strong through all this. Although, granted, she does have a very lovely basement pad to enjoy now. None of us can go down there and do anything. Yeah, it's very normal for babies to have the hiccups. Traditionally, we say that those babies tend to be a bit more colicky when they're born, but there's no risk, so don't worry about that at all. Will we receive a confirmation email to know that you have received our paperwork for embryo transfer from Nahal? Yes. So like every other center, although I haven't heard yet, I believe that the Nahal fertility program is shut down. They certainly should be, but I don't make their decisions for them. Once we have initiated the process of embryo transfer over from Nahal to either the other Toronto program or our Windsor program, we will most definitely notify you guys and let you know. There will be billing issues and transportation issues and consent forms and so on. Nothing is going to happen for a while because not even the cryo shipping company, the company that transports frozen products in liquid nitrogen, is willing to go anywhere right now. So everything is on standstill until further notice. Hi, Massa. I see one of our Nahal folks there. Maybe Massa can answer. Massa, is Nahal shut down? Maybe you can share that with us since you're watching. Somebody just asked that. Okay, what point in this cycle protocol would you add the letrozole? So if you're doing a letrozole and GnRH agonist cycle, I recommend 3 months of continuous use before the embryo transfer. 2 minimum, 3 is reasonable. What we like to do is do kind of 2 months and then in the 3rd month do the transfer. Otherwise you need yet another Lupron shot. If you're just using the letrozole alone, it's from day 3 to 7 in the cycle always. So cycle day 3 to 7, and that can be a cycle where we started your period from the birth control pill or from giving you progesterone or a natural cycle, but day 3 to 7 of bleeding. It paused. Anyone else? Oh, they're saying it paused. Are you guys paused? Yep, it's paused for some reason. Everybody's saying the video is paused. I wonder why. Should we stop and restart?
Yeah, that's my way.
I hate doing that. Can anyone tell us if it, check my phone. Can anyone tell us if we're paused on Instagram, YouTube? Instagram, I just got a message. Steiner7, bye. Oh, I guess it's paused.
What's going on?
I don't know.